Welcome to Untold Physio Stories, a podcast that informs and educates by connecting you to rehab industry leaders who share their candid successes and failures in business and practice.
Welcome back to another awesome episode of Untold Physio Stories. I'm one of your hosts, Dr. E, with Modern Manual Therapy, the Eclectic Approach, Untold Physio Stories, and Edge Mobility System. And my new co-host is
Dr. Andrew Rothschild, also with Eclectic Approach, Modern Patient Education, and now at Spear Physio.
awesome. Yeah, it's a great acronym. Sometime you can ask Andrew what it stands for. I feel like it's going to change every single time he says it, but we'll see if it stays consistent.
It's very possible.
Right. So you have a story for us today.
I do.
Good one.
I finally have a positive story as opposed to all my negative stories. I feel like are the ones I've shared the most.
Yeah, I know. Hey, you know what? It's okay to have a win every once in a while.
Yeah, I think it's good because that's kind of like I think the great thing about this podcast is that on most other podcasts and interviews you just hear about all the wins and how great everyone is. You don't hear about all the mistakes and failures, but I think it's good to kind of bring those to light sometimes.
That's right. We're human after all.
That's right. For once, I do have a positive one, and it's about a patient I'm still currently seeing. And she is a teacher. Well, first of all, she's a parent of a kid with autism, and she's a special needs teacher. So she kind of is getting it on all sides now in terms of the stress that kind of comes with that environment. But a lot of the kids that she deals with have some emotional and behavioral problems. And so she was actually hit in the chest with like a metal pencil box from one of her kids from the left side of her chest. And basically it was like a blunt force trauma. And she, developed some chest pain. It looked like she had maybe a slight bit of a rib fracture and some inflammation sort of around the lungs. But she was also getting these sort of, thoracic outlet type symptoms, tingling in the arm. She had a little bit of neurodynamic mobility restrictions, and she would have, get coldness in her hand. It would like feel cold, but it would also be temperature cold a little bit. And what would be interesting was that my boss has one of those laser temperature gauge thingies. And
pew pew.
Yeah, we brought it in, and so we would start to get like some objective baseline testing. Because sometimes I touch her hands and just by feel it, like it would feel normal to me, but it would feel perceptually cold to her. But I could get a little bit of skin measurement and compare sort of when she first came in, after doing a movement, after doing an exercise or a manual treatment, or even you've been using the mirror box as well. And the temperature would normalize, for example, after using the mirror box. So she might come in, it would be like 81 degrees on her right hand, which was the uninvolved hand, and 76 degrees on the left hand. Do mirror box for a few minutes and then recheck it. It would feel warmer, and then it would also measure warmer with the laser measurer. So that was really interesting.
That is interesting. Wait, I have to stop. Was she, because there's two ways to use a mirror box, right? A very sensitized limb is actually not going to move while it's in the mirror box, and you're only going to move the uninvolved. So it looks like it's moving, but from the illusion, but it's not actually moving because it's too sensitive to move. Was she not moving, or was she moving?
She was not moving.
Oh, she was not moving, and it's still the temperature's going up.
Yes.
Okay. That
makes it even more interesting. Yeah.
Yes.
She was not moving the involved limb and just moving the uninvolved limb. I was also doing it more for like the paresthesia part too. Not that it was too sensitive to move, but more for the paresthesia to see if it would change sort of the perception of it. Because doing different tests, I was still having a hard time of getting a real handle on where those symptoms were coming from, because it really wasn't from the neck. It didn't follow your classic patterns. It was more diffuse type symptoms, not a clear radiculopathy type referral pattern. But it definitely would change the tingling, and it would change the temperature using the mirror box. And even sometimes doing some thoracic and rib mobilizations would also result in changed temperature. But overall, she was still having these tingling. We weren't able to do things that would make lasting changes. It would always like these short-term changes, and any kind of activity or exercise she did, sort of the upper extremity, seemed to just flare things up. And so the last few weeks, we started talking about mindfulness. And I talked to her about mindfulness and kind kind of introduced her to a couple different apps, and then she started she was using Headspace on her own a few times, and she also started using it with her class. So with her class with special needs kids, and she's been using it now 5 or 6 times, and she's actually been putting this on Twitter, and I've retweeted it a couple times. And she's copying her administrators and principals and the school board on what she's doing, and she's going to try to start to track and see if it affects sort of like test outcomes. The fact that she has all the data from like the first couple quarters, and then now starting to use some mindfulness on a regular basis. And she's had a couple individual kids who've had some, special emotional and problems, and they've come up to her, and she's had them just do some breathing, or even gone through a short mindfulness session from the app, and they're verbalizing how much better they feel, and that she can visually see sort of them relax and calm down. So it's really interesting the fact, she's taking this, she's applying it to herself, and she's applying it to her class. And the most interesting thing, well, that part is the most interesting thing, but the other interesting thing is she emailed me the other day saying that all of a sudden her arm doesn't feel as tingly. And like I said, nothing for the past couple of months that we've done has really had a lasting effect on the tingling. But now that she's been doing mindfulness on her own for a couple of weeks, all of a sudden she's not having that consistent tingling. And is it because of that? I really don't know, but it's just an interesting coincidence, at least. And we know what the outcome of a lot of mindfulness training can be in terms of pain and stress reduction. But this is just a nice real world example, I thought, and the fact that she's applying it with her kids is also really great.
That's super interesting, and what a great way to pay it forward. I mean, I think most people wouldn't do that with your standard PT treatment. It's not like if ISTM helped their neurodynamics, as a teacher, they're not going to go start doing ISTM
on their kids.
Problem children. Yeah. Wow. Yeah. That's the, there are obviously a ton of studies out there that we've reviewed that show that mindfulness helps with from everything to pain to stress reduction to addiction. And, there are obviously just as many studies that show it doesn't really have significant effects like everything, because really everything either is going to work or it's not going to work.
Right.
Mostly due to non-specific effects, but that's very interesting. I mean, I think that maybe it potentially could be your breathing, even normalizing bicarbonate and CO2 outputs. I'd like to have measured her breathing with the Capno Trainer device that I use, because I've gotten TOS-like symptoms to reduce, and coldness in hands to change it as a perception, and also the temperature just by changing breathing strategies and normalizing CO2 output, or ATCO2, which you can only measure objectively with a Capno Trainer. But yeah, that's super interesting, and a perfect lead-in to where can you learn mindfulness as a physical therapist or a clinician?
Well, Ursula, I'm glad you asked. You can learn it through my course, Modern Patient Education, through the online seminar or the live version where we talk about that and how you can apply it in your clinical practice.
That's great. And the online version comes with several sample sessions that are audio recordings from Andrew. And also, you don't have to use the audio if you don't like his voice for whatever reason. I think it's great.
That's right. But, I mean, if you like my voice on this podcast and you just want more of it, that's a way to get more.
For sure. You could just play the podcast and the patient will the podcast itself is a mindfulness session. Just mute me out and the patient will just instantly have stress reduction.
Or stress decrease, either way.
Right. You can find that at modernpatienteducation.com. If you want to take any of our other eclectic approach courses online, they're all at edgemobilitysystem.com, or you can look at modernstrengthtraining.com, modernmanualtherapy.com. Make sure to subscribe to our email so you don't miss any kind of exclusive discounts on Edge Mobility System. You get all our blog updates, all our podcast updates. Thanks to Uptalk Media for hosting. I hope to see you in an eclectic approach course soon this year. If you like our podcast, please share it with everyone. You can subscribe now on Stitcher, Google Podcast, iTunes, not on Pandora yet, but that's a select few, and also on Spotify. And where can people find you again, Andrew?
You can find me at modernpatienteducation.com, but also social media at spear_physio for both Twitter and Instagram.
All right. Maybe we can have a nutrition focused episode next.
Oh, that'd be fantastic.
All right. We'll see you.
Bye.